The American Heart Association estimates that between 100,000 and 200,000 people die each year because someone does not do CPR at the proper time. I am CPR certified and have been for the past 6 years, and today I will demonstrate how to perform CPR on an adult and an infant. I believe this is important because everyone knows someone who is at risk for drowning, for a heart attack, or even a stroke, and may need CPR. In the next few moments, I will go over how the beginning steps of what to do before CPR, CPR on an adult, and CPR on an infant. So before you even do CPR, there are some things that you should do. And the very first thing you should do is to check the scene and make sure it's safe. For example, if there's a down power line that made somebody unconscious, you don't want to accidentally run into the power line and therefore create another victim, because that's the worst thing you want to do, is make yourself the second victim of an incident. After you deem that the scene is safe, the next thing that you want to do is to check the alertness of the individual. So you will go over to him or her and pat their shoulder forcefully and say, hey you. And if they are alert, then they might respond, but if not, then you'll go to the ABC method. Alertness, or airway, breathing, and circulation. So by checking the airway, you will tilt the head up on the individual and open up their mouth, and you will look down their throat to see if anything is clogging the airway. And if there is something clogging the airway, you will of course use a tool and take it out, or maybe even use your pinky. But if there's nothing blocking the airway, you will go to B, which is breathing, in which you will place your ear to the mouth of the individual and you will try to listen if they are breathing, and you will also look down their chest to see if it is rising and falling to see if they are breathing. If they aren't breathing, then you'll go to circulation, in which you could check for a pulse on their neck or their wrist. After you've gone through these 3 steps, you will then proceed to CPR. So for the first step on CPR, you will kneel down beside the individual. You will place one arm or one hand over the other, and you will curl your fingers around to where your heel of your hand goes on their sternum, right in between their nipples. And you will do 30 chest compressions at 120 beats per minute, or about the same pace as the Bee Gees' Staying Alive, or Another One Bites the Dust, more ironically, by Queen. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And of course you'll do 20 more. And make sure to keep your elbows locked and rock from the hips. So after you're done with your 30 chest compressions, you'll move to 2 rescue breaths, in which you'll pinch off the nose of the individual and you will do mouth to mouth and breathe into them twice. It's a common misconception that all we breathe out is carbon dioxide. We actually breathe out a lot of oxygen, in which case will flow into their lungs and help oxygenate their blood. And that's how to do CPR on an adult, but CPR on an infant is quite different. So CPR on an infant will do the same exact beginning steps. So you will check the scene, make sure it's safe, and you will also check the alertness and go through the ABC method, making sure there's nothing blocking their throat. Then after you do that, you will place the infant in your right hand or non-dominant hand, and you will perform 5 back blows when the baby is facing down. So you'll brace up against your body somewhere, and you'll do 1, 2, 3, 4, 5. And the reason that is because you want to try to get out any blockage that might be in the infant's throat, because the most common reason that infants may need CPR is because something is blocking their throat. After you're done with 5 back blows, you will flip the child over, and using your middle finger and your index finger, you will place it right above the sternum, in between the nipples again, and do another 30 chest compressions at about 120 beats per minute. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and so on. After that, you will do the mouth-to-mouth procedure, except your mouth will be covering both their nose and their mouth, and you will do another 2 rescue breaths. And for both adults and infants, you'll perform CPR until the first responders arrive or EMTs arrive. So in the past few moments, I went through what to do before doing CPR, how to do CPR on an adult, and how to do CPR on an infant. And hopefully none of you get into the scenario that you have to use CPR, but hopefully these steps today will guide you and to help save another person's life. To restate, the American Heart Association estimates that between 100,000 and 200,000 individuals pass away each year because someone did not do CPR. So hopefully we can lessen that number and make the world a better place. Thank you.